So I'm Hyde from Alveo. I'm really pleased today to be interviewing Dr. Richard West MBE, who is the Chairman of the Dispensing Doctor Association. At Alveo, we're passionate about supporting dispensing doctors, so it's a real honour to have you here today, Richard. The question I'd really like to ask you is, obviously it's been a horrendous year over last year. There's been so many challenges with COVID, and also it's been a busy time in terms of rolling out the vaccine. What has been the real challenges for you, and how has it impacted on your day-to-day?
In terms of the dispensing, there really have been two great challenges. One has been supply, and supply has been a bit patchy, to put it politely, in some things. Inhalers were very difficult at one stage of the year. I could talk about ranitidine for ages, but that was pre-COVID. But all sorts of supply issues have come up, and they have been challenging in themselves. At the same time, we're having to deliver a service in a way that we're not in contact with patients in the same way. So providing delivery services for those who were shielding, and providing a service where there was a distance between patients collecting the prescription and our staff, and trying to keep things safe. At the same time, trying to keep our staff safe. The other thing to say is that the number of deals and discounts available in the marketplace has fallen over the past few years. And this is very difficult, in that the reimbursement scheme for dispensing doctors was set a number of years ago. It hasn't been reviewed very recently, and we have a clawback of 11.18%, which means that if we buy them at tariff price, we're going to lose money by dispensing them. And that's not a business model that works for anybody. And if you look at the dispensary in terms of an integral part of the practice, roughly speaking, half the income generated and the profit from the dispensary goes on to support the GMS part of the practice. That is, support nurses, support receptionists, support extra doctors. And if you lose that income out of that piece of the income that you're getting from the practice, then you're going to have to cut back on your expenses, which means cutting back on staff or cutting back on the number of doctors. And we have to remember that actually the infrastructure of rural dispensing practice is very fragile. It's very much like rural post offices. And once you lose a post office, it never seems to come back. Therefore, if we start losing dispensing practices, we'll end up with people having to travel large distances. It will make access to healthcare more difficult. And the group that I particularly worry about are the group in rural areas who don't have a lot of income. And I know people look at rural areas and think it's people have more income and have a car, but there are also a group there that don't have the income, don't have the access to a car, rely on public transport. And actually, if you take away the rural healthcare infrastructure from them, they will find it accessing healthcare very difficult, because the transport just isn't good in rural areas.
I think that's a really compelling argument there, Richard, around supporting rural healthcare and the patients through pharmaceutical support as well, in terms of the offerings which are out there. But with dispensing practices potentially writing 15% of the prescriptions across the UK, do you think that pharmaceutical companies actually focus enough on providing these sorts of deals and offerings?
I know 15% is only 15% of the market, but it is a substantial part of the marketplace. And actually, if you look at the CQC results for dispensing practices, there are more dispensing practices who get excellent or good than there are of non-dispensing practices. The proportion is much higher. Therefore, actually, they provide a very much a quality service for their patients. And that must be something that a pharmaceutical company would want to be associated with. And it's about making their drugs accessible to patients and not putting unnecessary barriers in the way to stop their drugs getting out to the people who need them.